Joining us now is Dan Geltrude. He is an accountant and founder of Geltrude and Company. Dan, thank you so much for joining us. What are some of the tools that people should take advantage of when thinking about future healthcare expenses? Often we don't think about future healthcare expenses, but there are pretty simple tools that are available to us.
There are some simple tools. And to start with, how about staying healthy? And that could be very simple. Eat less, move more, right? So that's where it all starts. The next thing is when you do seek medical care, stay in network. That's how you're really able to keep your costs down. And along those same lines, use generic prescriptions. If the drug can do absolutely the same thing, why pay more? Now, there's two other tools that you could make use of if they're available for you. That's an HSA and an FSA. So the HSA, which is the health savings account, you own that and you get to put pre-tax dollars there. It earns interest, and if you change employment, you could take it with you. The flexible spending plan is a little bit different. It is pre-tax dollars. However, it's owned by your employer. It doesn't earn interest, and you must spend it within the plan year.
Yeah, I think a lot of people don't take advantage of those plans the way they should, because often you're not anticipating, a healthcare crisis or situation the way you might be anticipating childcare. You know that's coming up. Healthcare is also a pretty big expense in retirement. So if you're not working, how can viewers who are looking towards retirement, getting ready, how can they prepare for that?
First, we need to start with what these numbers actually look like. Now, according to Fidelity, they have estimated that a retired couple in 2021 will need $300,000 to be able to cover healthcare costs through their retirement. That number is staggering. So what to do? Well, you need to start saving as early as possible. As the saying goes, best time to plant a tree, 20 years ago. Second best time is today. So start putting those dollars aside in anticipation of what costs you're going to have in retirement, especially for healthcare, because that literally will be your highest cost that you have to recover. Now, what the shame of this is that nearly half of American adults will actually put off their health care needs simply because they don't have enough dollars to cover it. And that really is a shame, and that shouldn't happen.
So lastly, if you are hit with an unexpected medical expense you didn't plan for, do you have options?
Well, look, if you have medical coverage, which of course everyone should have, you want to make sure that your policy is up to date and that it's going to protect you from major medical emergencies, because that is really what the risk is. If you don't plan for that, it could literally bankrupt you. Now, there is some good news here, because Congress this year did pass the No Surprise Act. So starting in 2022, what it means is that a doctor must get permission from the patient before they start to charge out-of-network rates for any type of medical services that are performed. And that is really important because, as I said earlier, where costs really build up is when you're going out of network. So I would also tell you this. Don't just accept your medical charges as is. You're the consumer. You have the right to question these things. So review your medical bills very, very carefully. Shop around for the medical services that you may need, and ask to reduce the charges. Again, you're the consumer. You're the customer. Why pay more if you don't have to? There could be some negotiating in those costs.
Really good reminder. You may have a little more power than you think you have. Dan Geltrude, thank you.
Thank you.